Welcome to Ulosca channel. Access all nursing practice questions. ATI fluid and electrolyte practice questions with answers.
Question 1. A client has a sodium level of 128 milliequivalent L. Which condition does this indicate? A. Hypernatremia. B. Hyponatremia. C. Hypokalemia. D. Hyperkalemia. Which one is the correct answer? The correct answer is B. Hyponatremia. Explanation. A sodium level below 135 milliequivalent L reflects hyponatremia, a condition that can cause symptoms such as confusion, headache, muscle cramps, and in severe cases, seizures due to fluid shifting into brain cells. Question 2. Which of the following is a sign of hypokalemia? A. Muscle twitching. B. Bradycardia. C. Abdominal distension. D. Increased deep tendon reflexes. Which one is the correct answer? The correct answer is C. Abdominal distension. Explanation. Abdominal distension is a common sign of hypokalemia due to decreased gastrointestinal motility. Potassium is essential for smooth muscle function, and a deficiency can result in slowed peristalsis and constipation. Question 3. What fluid should the nurse expect to give for a client with dehydration and normal sodium levels? A. 0.45% normal saline. B. D5W. C. 0.9% normal saline. D. 3% saline. Which one is the correct answer? The correct answer is C. 0.9% normal saline. Explanation. 0.9% normal saline is an isotonic solution used to restore circulating volume in clients with dehydration without disturbing electrolyte balance when sodium levels are normal. Question 4. A client has a calcium level of 6.8 milligrams DL. Which sign should the nurse expect? A. Negative Chvostek sign. B. Muscle flexidity. C. Positive Trousseau's sign. D. Hypoactive bowel sounds. Which one is the correct answer? The correct answer is C. Positive Trousseau's sign. Explanation. Positive Trousseau sign is a classic neuromuscular manifestation of hypocalcemia. It involves a carpal spasm triggered by inflation of a blood pressure cuff and indicates increased neuromuscular excitability due to low calcium. Question 5. Which electrolyte imbalance is commonly seen in clients with renal failure? A. Hypomagnesemia. B. Hyperkalemia. C. Hypocalcemia. D. Hypernatremia. Which one is the correct answer? The correct answer is B. Hyperkalemia. Explanation. Hyperkalemia is frequently seen in renal failure due to the kidney's reduced ability to excrete potassium. This can lead to dangerous cardiac arrhythmias and requires immediate monitoring and treatment. Question 6. A client with hypernatremia is likely to experience which symptom? A. Confusion. B. Crackles in lungs. C. Moist skin. D. Bradycardia. Which one is the correct answer? The correct answer is A. Confusion. Explanation. Confusion occurs in hypernatremia because elevated sodium levels cause water to move out of brain cells, leading to cellular dehydration and neurologic symptoms like restlessness, irritability, and altered mental status. Question 7. Which lab result indicates fluid volume deficit? A. Decreased hematocrit. B. Low urine specific gravity. C. elevated BUN. D. Hyponatremia. Which one is the correct answer? The correct answer is C. Elevated BUN. Explanation. Elevated BUN is a marker of fluid volume deficit because dehydration reduces renal perfusion, concentrating blood urea nitrogen. Hematocrit and urine-specific gravity may also increase in dehydration. Question 8. What is a priority intervention for a client receiving 4-magnesium sulfate? A. Monitor oxygen saturation. B. Encourage fluid intake. C. Monitor deep tendon reflexes. D. Increase calcium intake. Which one is the correct answer? The correct answer is C. Monitor deep tendon reflexes. Explanation. Monitoring deep tendon reflexes is essential during magnesium sulfate infusion because loss of reflexes is an early sign of magnesium toxicity. If reflexes diminish or are absent, the infusion must be stopped to prevent respiratory depression. Question 9. A nurse is assessing a client with fluid overload. Which finding is expected? A. Flat neck veins. B. Decreased respiratory rate. C. Bounding pulse. D. Weight loss. Which one is the correct answer? The correct answer is C. Bounding pulse. Explanation. A bounding pulse is expected in fluid overload due to increased circulating volume. Other signs include edema, crackles in the lungs, and distended neck veins. These symptoms indicate a need for fluid restriction or diuresis. Question 10. A potassium level of 6.2 milliequivalent L is reported. Which action is the nurse's priority? A. Encourage potassium-rich foods. B. Monitor bowel sounds. C. Place client on a cardiac monitor. D. Administer oral potassium. Which one is the correct answer? The correct answer is C. Place client on a cardiac monitor. Explanation. Placing the client on a cardiac monitor is crucial in hyperkalemia because elevated potassium levels can disrupt cardiac conduction, leading to arrhythmias. ECG monitoring helps detect early signs of cardiac involvement like peak T waves.
Thank you for watching. For more practice exam questions, subscribe to our website at www.ulosca.com.